Let's just see. Where is Emily? Well, I hope she didn't stuck in the traffic. So in
Oh, no, I'm here.
Oh, Emily, hi, how are you?
Hi. I'm good. I'm just joining from a hotel, so it took a while to get it connected. But yeah, excited to get started and great to see everyone. Thanks for making the time.
Yes, fantastic. And I'm so happy that, we are doing this and we have received a fantastic feedback already about the webinar. We had a huge number of sign-ups, many requests to share the recording. So I'm very, very excited to, shine the light about what exactly hormones can do about, about our body and the brain. And then we will, yes, shine the light about what tips can be given and what can we do about this. So yeah, so welcome everyone, and my name is Marija. I'm the founder of Plan Your Baby, and tonight, as I said, so we are going to discuss what exactly IVF really does to your brain. And so I chose this topic deliberately. So because when most people think about fertility treatment, they think about the medical side, but about the scans, the injections, the embryo transfer, and all of that really matters. But there is another side that actually nobody prepares for. And what happens to you emotionally, psychologically, and neurologically. And that's what we are going to talk about tonight. So can we go to the next slide, please? All right. So yes, so my name is Marija. I'm the fertility nurse by the background and with more than 15 years of experience in fertility field. And in my career, I have spoken to more than now 20,000 patients. So, and I have heard multiple stories and yes, witnessed all sorts of situations. And I think tonight also I can confess that I'm a good subject about this topic. I've had miscarriages as well myself in the past, and I did egg freezing a year ago. So I think, Emily, it will be good to, from the first mouth, to share what exactly happened to my brain when I went through this turbulence of fertility treatments. Emily, could you please introduce yourself before we start?
Yeah, 100%. My name is Dr. Emilė Radytė. I'm a neuroscientist by training, so I've spent all my life studying the brain and trying to understand how it works in both healthy states as well as in more disease states. And for the last 5 years, I've been the CEO of Samfire Neuroscience, where we build neurotechnology-based solutions specifically for women's health, because we realized there was a huge gap of essentially the brain being forgotten in women's health, and where a lot of the changes do happen. So when hormone changes happen, our brain changes as well. So really excited to be joining Marija and the whole team at Plan Your Baby to essentially bring some of those tidbits of knowledge to everyone to feel more empowered. Because we know that even when there's few solutions, education is the most important one, and knowing what's happening is always state one, and then you can decide what to do about it as well. So thank you all for joining.
Thank you so much. All right, let's start. Can we have a next slide, please? Okay, so perhaps I will start with just a little bit of basics. And because even if you've been trying for a while, so most people actually haven't had this explanation and about the hormonal cycle. So here in the chart, you can see the few stages of the cycle, menstrual cycle. So, and our reproductive system runs on a cascade. So the hypothalamus, which is the part of the brain, sends a signal, gonadotropin hormone, to the pituitary gland. Now, which releases very important hormones like FSH and LH. And then the FSH, what it does, it grows the follicles in our ovaries. Now, and then the ovarian hormone called estrogen then rises up, and then as the follicles develops, and then around day 14, which you can see on this chart, a very beautiful peak. This is where the LH hormone starts to perform and it surges. And this is exactly what we call ovulation. So, and afterwards, you can see the beautiful purple line going up. This is another hormone that is part of our orchestra, is the progesterone. So the progesterone then takes over and preparing the implantation environment for the embryo and for potential pregnancy. So the entire process we call as HPO axis. So it's a very beautifully, positioned and illustrated here. And it is very important that we understand this chart and the function of the hormones before we start any treatment, because very often treatment then are considered based on outperformance or dysfunction of those hormones. Can we go to the next slide, please? So the very important stages in our menstrual cycle. So when we are trying to conceive naturally, there is a narrow window, what we call ovulation, where actually the fertilization of the egg can be possible. So ovulation lasts approximately around 24 hours. For some patients, it can be about 28 hours, but I would say on average, it's about a full 24 hours. And then the fertilized egg travels through the fallopian tube, which we call then afterwards embryo, and it starts to slowly develop to day 5 or day 7, which also we call blastocyst stage of the embryo. And this is the time when embryo implants. Now, the implantation actually happens around day 6 to day 8 after the fertilization. So we know that it can implant on day 5, on day 6, sometimes on day 7, and in some research papers, we know that it can happen even on day 8. And the progesterone is absolutely critical at this stage because it will support and maintain the lining and will support the implantation. And very important to know that actually 1 in 6 couples have issues and can't conceive naturally due to many, many factors, including some ovulatory disorders, which we showed in the chart, some structural issues, sperm-related factors, and something that very, I think, popular term becoming unexplained, which is actually, I think, the hardest to hear when someone is telling you, we can't explain why you can't conceive. Can we go to the next slide, please? So a few treatments, what can be applied when we have this hormonal dysfunction or any other diagnosis. So when natural conception isn't working, now we of course can bypass those processes and help with some hormones and different type of treatments. And the most mildest and I think the most more closest to natural conception is something that we call ovulation induction or assistance with conception. Now, it's very, I think, can be beneficial to have this treatment when we have the absence of ovulation or, for example, condition like polycystic ovaries and cycles can be irregular. So by prescribing some medications and to give a bit of control to a doctor over your hormones can get you to a success without necessarily going through IVF straight away. And of course, the treatment that perhaps you have heard is IVF. And when actually we have to stimulate you, we have to prescribe you the injections, the hormones every single day. And then we will get you to the stage of egg retrieval, fertilize eggs in the laboratory. And then we will transfer embryo into the uterus during the slightly invasive procedure. So it's similar to the smear test procedure, which is painless and performed without any sedation. And another treatment that can be done to support the fertility or preservation of fertility, if I may call it, is the egg freezing. So, and I will share a bit more about this, about my experience later on. But the process of the egg freezing is actually very, very similar to the IVF. Many may think that it's very easy process and it just lasts for 12 to 14 days. But actually, the stimulation phase is no different from the IVF process. You still have to inject yourself with multiple injections every single day for like 10 to 14 days. And actually, your body goes through the same hormonal turbulence and the same psychological aspects as if you are having IVF treatment. Can we go to the next slide, please? So in terms of the assistance with conception itself, so how it's performed, here you can see a very similar chart to natural menstrual cycle. So an assistance with conception is just a slight support with medications called letrozole, or in the past, if you have heard medication Clomid. So what they do, it's anti-estrogen hormone, but then it stimulates the ovary, it boosts the FSH and supports the follicle growth. And then also it supports the multiple follicle growth. So in some cases, during the assistance with conception, you may actually develop more than one follicle, which will be very similar to IVF treatment with less follicles perhaps, but still you may have multiple follicles. And then we would imitate the ovulation. If it's not happening naturally, we would give something that's called trigger injection. So we actually can have a control of this LH surge, and we prescribe an injection. I think someone is, talking. So yes, so you have an injection, and we time this injection very, very carefully because it's important we give it to you specifically when you need it. So then we can achieve this maturation of the egg. And then we follow with the progesterone hormone. So as you can see, the chart may look very, very similar to your menstrual cycle, but it's fully supported with all of the medications to maximize the chances of conception. Okay, I think we can go to the next slide. So talking about the IVF, I actually during my career kept hearing that regardless of the diagnosis, many clinicians will just say, yes, just have IVF. But very little we know that sometimes IVF may not work from the first attempt, and actually it can be quite overwhelming. And it's important that you know the numbers around IVF. So it does take around maybe 1 month to complete full treatment from the beginning to end. So when you have your pregnancy test, and so far we have now more than 8 million babies born through IVF approach. So we definitely learned a lot, and definitely science is there. And we've achieved a lot in the last 45 years in terms of improving the quality of the treatment. The medications changed, the formulas changed, the egg collection approach as well changed, because I remember back then eggs were collected through laparoscopy when actually patient needed to have a proper surgery. Now some patients go through this procedure even without sedation, which I would not recommend, but those cases exist. And in terms of the success rates, here I will share the nationwide statistics. Unfortunately, they're not as inspiring as we would like to see, even in 2025, with all of this, science in our pockets and all of the knowledge. Still, IVF is not a guarantee. And sometimes, it really can feel like a full marathon that, you have to have treatment after treatment after treatment. And it's a really huge, emotional burden to go through this. Okay, can we go to the next slide? So to explain what's happening in terms of the hormonal chart during the IVF cycle, I will just shine a bit of light in terms of the hormonal changes. So the injections that we prescribe during the IVF, patients do take on a daily basis, and sometimes it needs to be multiple injections, is the combination of FSH and LH hormone. And it can be one medication or different medications. For example, at Plan Your Baby, we are very, very precise. We do your blood test every other day or even every day. Now, the purpose of this, so we can give you the stimulation medication precisely according to your hormones. And that really helps us to achieve this balance of what we would like to see on the day of egg collection. And we also have to prescribe a medication to control your ovulation, because as you imagine, when you go through IVF cycle, you produce, and the goal is for you to produce multiple follicles, and that's the difference during this treatment. So we would like to collect multiple eggs, And the most important, they are mature eggs. We fertilize them, and we have to make sure you don't release them before the procedure. Otherwise, it would be really a shame to go through all of this. So what we do, if you see on day 14, something similar to LH surge, this will be imitated with the medication called trigger shot. So either Zivafert or Ovitrel, there are other types of trigger injections. Sometimes you may be asked to take even multiple trigger injections. So we call it dual trigger. It's the two type of injections that we ask you to take. Now, the purpose of this is to maximize the number of eggs that we're going to collect at the right maturation stage, because this is what will affect your fertilization rate. And then, of course, when we come to egg collection procedure, it feels like every patient went through the hormonal earthquake, because your hormones, if you think of, will, be 20 times higher than during your normal cycle. And if you ask me, was my body prepared to go through this turbulence? I doubt it. And if I ask my brain, like, oh, did you know that you're going to go through this? The brain will just, collapse from the amount of information, the hormonal change. And then, and then the number of symptoms the patients experience during those changes is just enormous. So we can go to the next slide. And just to explain a bit of a difference in terms of the egg freezing, which also is the invasive hormonal treatment. So ideally, we would like to retrieve 10 to 15 eggs. Some patients will produce more, some less. But looking at the statistics, ideally, yes, I would say 15 to 20 would be a very good number, but every single body is different. And as we know, for pregnancy, we just need one good healthy egg, genetically healthy. So yes, even though we focus on numbers, sometimes we have to disregard this and remember that quality is as important as numbers. So those eggs will be frozen in the liquid nitrogen. It's a rapid freeze. And now in UK, you can keep your eggs for up to 55 years. And usually the procedure is advised to be done for age 35 and below, but we still can do we still can do the treatment for patients age of, I would say, 38, 39, and we had patients doing egg freezing actually at age of 40 and had live birth. So I always try to tell patients, even though, numbers may not support, but every single patient is so different. So you never can 100% relate yourself to just, make it statistics. Okay, so we can go to the next slide. Okay, so here perhaps I will not focus too much, but it's just again to show from the hormonal perspective that, as you see from the chart, your body will go through absolutely the same process as IVF. So when someone is telling you that, the egg freezing is an easy treatment, just go for it, you just inject yourself, eggs will be collected. No, do not believe those statements, because your body will go through absolutely the same process as IVF for the first 2 weeks for sure. Okay, let's go to the next slide. Okay, so what we exactly do with your hormones now is very interesting. So in some situations, you perhaps heard a sentence, shutting down the ovary, suppressing the ovary. Yes, there are medications that actually can suppress the ovarian activity. And then with medications, we rebuild this activity fully. So that means you will receive a different type of medications, and your stimulation will be for a longer time. That means that you are going to be exposed to a different chemicals, and you may have more symptoms in terms of going through this stimulation. And then the injections itself, the hormones, as I said, and then the trigger shot, which is completely different type of hormone. It's either HCG or, high dose of LH hormone that can be given. And then that helps us to mature the eggs, and then we can retrieve the eggs. Okay, so I think we are getting to the most important now, slowly slides that we are going to discuss exactly why we are here. Now, very little patients know, but the numbers are huge. Those who will experience the mood swings, the anxiety and uncertainty, sometimes the grief and the loss, the relationship strain, and sometimes you may question your identity and self-worth because the treatment is not really working the way how it's been planned, and very little we knew that we are gonna go through this. When we were young, we never were told what can happen to our body and what kind of difficulties we may face, and never mind about the whole isolation, and that the relationships will turn into the medical event rather than some kind of like intimacy and enjoyable time with your partner. So those things will be different, and we see from the numbers that they are high. They are really high. At least 10% will experience some symptoms, and some patients, 60% of those who are going through this treatment will experience, for example, bloating or abdominal fullness. Some patients will experience even the hyperstimulation as well, which means that your hormones can really quadruple compared to your natural cycle. Okay, if we can go to the next slide. Okay, so in terms of the tips, I think the tips, the emotional, the psychological, impact that we are going through, it's always important to remember that you have to give time to yourself. You have to get perhaps right support, because the isolation, the anxiety, and the stress, it can create a huge burden. And on top of all of the hormones, that our body and brain will go through, it's very easy to start to feel down, to experience anxiety, to be, being not yourself, and then as well that, it may feel like the whole world is collapsing, and you start to argue with your partner. So it's very, very important to surround yourself with the right support. And I think if you do understand the process, sometimes it's even easier to find those pathways much quicker. And I remember when I was doing egg freezing, I was so mad at my partner, and we just had a miscarriage, and I was like, you don't understand me, you don't support me, and I wouldn't even trust him to do the injection, because I was, no, I can't even trust you this. So I was injecting myself, and I remember the trigger shot, and I had to do it very, very late. So yes, I did not enjoy the process at all. I think we can go to the next slide. Okay, so I think here I will just stop for 1 minute just to explain why exactly I have started to work on the project Plan Your Baby, and purely because of the exposure, talking to patients for more than 15 years and hearing what they go through. It was very, very clear to me that there must be a way of how to provide very tailored holding hand treatment, very precise from the clinical perspective, and make sure that patients will feel very supported and they will receive the top quality care. So we do have a huge expansion in the country, so our patients actually don't need to travel anywhere. We do the treatment from the comfort of where they live. 7 days a week we work, and our nurse is available even, at a very, very late, if patient feel that she needs to speak to someone. There is a way of contacting us via WhatsApp or phone call, whatever is easier. So we can go to the next slide. Yes, so if you would like, you can grab the QR code and book a free call. And now I will pass to Emily. So Emily, please explain exactly why behind everything I just described. And yes, so the floor belongs to you.
Amazing. Thank you so much for such a great overview. I'll just ask the host to allow me to share my slides so I could keep on going. But as Marija has mentioned, we'll be covering kind of what's happening with the hormones and then in parallel what's happening at the brain level. Because again, when you go seek fertility treatment, and she has outlined how amazing the care they provide is, for all of the patients, but the things that you're going to be talking about with your clinician is going to be, this is the injection you need, this is what the hormones that are coming into your body are, and I'm here to help you understand how your brain responds to what those hormones do. Um, just asking again for permission to share. Don't think it's on my side. Oh, great, perfect. Marija, can you confirm you can see my slides well? You're on mute, but this looked like a happy face, so I assume you can see my slides.
Yes, thank you.
Amazing. Great. So yeah, as I mentioned, I'm a neuroscientist, so we'll kind of recap some of the things Marija mentioned, but with the brain in mind, and then go a little bit deeper. About myself, as I mentioned, I'm a neuroscientist. I lead a neurotechnology company that's fully focused on women's health. And having worked as an emergency medic, I really care about translational solutions. I know Marija shared that, she has gone through the journey herself, but also is very committed to making this experience better for patients. And that's the same case for me. I've experienced a lot of kind of hormonal transitions and mental health symptoms associated with them. And being a researcher in the neurotechnology space, was shocked how few solutions there were. And the only solutions I was offered is to go on hormonal contraception, which obviously, if you are trying to conceive, is not going to be an option. And so kind of built a company around the idea of offering women more options than the default ones being offered there. And the one thing that I did want to mention, and I already saw that in the comments as well, is that I will be talking quite scientifically. The purpose of this is to be very approachable and useful information as well. But I do want to say that, research in this area is wide, but not very extensive, especially on the mental health side. And so if there's anything that I say, oh, you will experience X, Y, and Z, and you experience a different thing, that's totally valid as well. Like, science is still catching up on women's experiences and doesn't have a good way of studying them just yet. So I will cover the latest of what we know and how we can manage it, but your experiences, and you are the expert of your own experiences. And so don't use any of the science that I present today to tell you that, whatever you feel is not normal or otherwise. It's just to understand where it's coming from. So Marija briefly covered the HPO axis, so essentially the hypothalamus, pituitary, and gonadal or ovarian axis. And here I just want to dive into it a little bit deeper. So when we talk about hormonal regulation in the body, those are the three main bits that you should kind of roughly know about. So when we talk about the HPO axis that regulates hormones, that involves three main parts. Hypothalamus, the first bit, is actually this subset in the brain, highlighted in blue. And it's essentially a part very deep in the brain that is preserved between us and other animals that is responsible for our reproductive function. So pretty much in the brain, everything that is kind of related to an animal preserved function is going to be deep in the brain, and everything that is uniquely human will be more superficial in the curly part of the brain. And so you can see that obviously reproduction is a core necessity to being human, because reproducing is how we maintain ourselves and how we evolve to stay advantageous as well. And so that part is deep in the brain as well. So hypothalamus is the kind of initial control center where everything around hormonal regulation starts. Then the hypothalamus uses hormones to essentially instruct the pituitary, which you see in the middle here. And the pituitary is kind of an in-between relay center that decides when to release hormones, in what pattern, which will become relevant, and how much of the hormone as well. And then once it makes that decision, it informs ovaries in women or testes in men. It's actually the same process in men and women, deciding on how many hormones are being released. And then once those hormones, so for women specifically, estrogens and progesterone, get released, then those are received by the brain as well. So a couple of key factors to know here is that the brain is where hormonal control starts. So hormones can't be released in isolation by our bodies. It's the brain that controls it all. And the brain also has receptors for estrogen and progesterone. And those receptors are critical so that it knows that the HPO or HPG axis did what it was meant to do as well. So that's really, really important, those two things, that the brain controls it and the brain also receives signals from our hormones in order to know what to do next. And this is important because cycles are very predictable. So here we're talking specifically about menstrual cycles that really rely on being predictable. I'll spend a couple of minutes because Marija has already covered kind of the basics of the menstrual cycle, but essentially everyone in the audience will know that the menstrual cycle governs all of your life. It's not just the day you bleed, which is menstruation, but actually your entire cycle is governed by hormonal shifts, uterine shifts, what your eggs are doing, etc. And so in rough terms, you ovulate about halfway through your menstrual cycle. And the first phase of that cycle is called follicular. The second phase of that cycle is called luteal. In the luteal phase, the main hormone that dominates is progesterone. And in the follicular phase, estrogen is the main hormone that kind of rises throughout the follicular phase. And then exactly at ovulation is when your egg actually ovulates. And then if it is not fertilized, we get rid of it in the menstrual cycle. So at day one of your menstrual cycle as well. And so the key thing to remember whenever we think about the menstrual cycle, and again, we touched on it earlier, is that it's a very highly orchestrated process that is controlled by the brain. So it means that the brain needs to make sure that across the follicular phase, your estrogen needs to increase. Right before you ovulate, FSH and LH do a little peak. After you ovulate, you need to have progesterone rising. And in the case of pregnancy, you need to have progesterone maintained. And everything relies on these hormones functioning perfectly together in order for you to menstruate every month. But if you do get pregnant that cycle, it's also for maintaining pregnancy as well. So it's a very tightly regulated system. And that becomes important because in many cases, whenever there is this regulation can happen at so many levels. And Marija mentioned earlier that one of the most commonly identified causes for infertility is now called unknown or undetected. And so that's obviously a very frustrating thing to hear. But part of it is because it's such a complex process of the menstrual cycle altogether that there could be things going awry at so many different stages. Let's say your estrogen didn't rise as expected, your FSH and LH didn't peak when expected, or they peaked but not at the same time, or your progesterone didn't maintain itself and couldn't maintain the pregnancy. So there are so many reasons that are directly linked to how complex the menstrual cycle is that will impact your individual chances of conceiving, as well as on IVF success as well. So everything starts with a pulse in the brain when it comes to regulating when exactly you ovulate. So to go through it, GnRH is one of those molecules that essentially instructs estrogen and progesterone to be released, but it doesn't just release estrogen and progesterone continuously. So it's not like it gives a signal to release and then the floodgates open. Instead, it actually releases them in pulses that happen about every hour and a half or so. So the pituitary, that organ in the middle between the brain and between the ovaries, is actually not just giving the ovaries a signal of produce everything. It's actually trying to understand what signal it's getting based on the frequency. So based on how many pulses it gets per unit of time. And depending on how many of those pulses it gets, it decides how much and of which hormone to produce. So we know when the pulses go very quickly, that's actually kind of like a Morse code or a secret code for the pituitary to release LH, the luteinizing hormone, one of the key hormones that will trigger ovulation. And it's no surprise, therefore, that increases across the follicular phase. So in general, we know that the frequency increases of the signaling increases throughout the follicular phase as well, so that it could peak and be at its highest frequency right before LH is expected to be released in the brain. And then on the other hand, it starts slowing down and we have pulses every 90 to 120 minutes. And then we have more FSH compared to LH, which is that other hormone that acts in tandem with it as well. And so essentially we know that for healthy menstruation, this is what's happening already by the body. And this is how exactly the brain regulates your hormones, literally by choosing how fastly it emits that GnRH pulsation mechanism as well. And we know that in order to kind of create an IVF process where the IVF process takes over ovulation instead of the natural ovulation processes, we will need to be disrupting that pulse frequency because that's what's going to impact and allow for the IVF process to be in charge. So just to kind of illustrate that, essentially, if we administer that molecule continuously, then we will disrupt the cycle. And if we disrupt it in a precise way, in this pulsatile way, we'll be able to get in control. So that's really, really important. So essentially, IVF protocols work exactly by taking over that pulsatile nature of everything. And essentially, they take the wheel and control the cycle. And the main way that they do that is actually by getting rid of the brain. So it's not like the drugs necessarily go to the brain directly first and try to kind of reroute how the hypothalamus works and change the frequencies and everything. Instead, it tries to cut off the brain, which normally controls the cycle altogether. So there's a couple of mechanisms that have been used. So specifically, the GnRH agonists and GnRH antagonists are two common ways in which that IVF process has been used. Now, the antagonist path is the most common one. And we won't go into the detail here, but both of them essentially work by cutting out the brain. So in the case of agonists, we essentially initially stimulate the brain. So these are usually protocols that start in your luteal phase of the previous cycle and then take over control. Antagonists, which is the much more common kind of way of taking over control now, just kind of turn off the brain. And the main way that they turn off the brain is essentially by just producing so much of the hormone that the brain doesn't know what's happening and therefore kind of loses overall regulation of the cycle. And that's when your injections, the ones that you would be doing every day, take over the cycle control for the brain as well. The reason that's important is actually most of the side effects that Marija covered so eloquently are actually dictated by the brain being confused by whatever is happening because it likes being in charge and it likes responding to whatever it's doing. But now we've cut off the brain, so the brain is no longer part of the story. And instead, we now have it taken over with these like kind of synthetic hormones that are regulating your cycle instead. And so we know that because, so this is an agonist specific only, so that pathway that is no longer popular, there is essentially a hypogonadal state in the brain. So that means it's just hypersensitive to everything in its environment. So that can lead to some side effects. We know that estrogen levels can drop to postmenopausal levels. So that can cause symptoms that we've described as headaches, hot flushes, and low mood that are really common. We'll delve deeper into those as well. We know that antagonist protocols usually try to maintain as normal a physiological hormonal baseline as possible. And we know that generally that downregulation period tends to be more challenging for those effects. But essentially, all of this to say is that because we are taking over the brain, taking over the cycle control, getting rid of the brain in the process, patients will experience both hormonal effects, but also the brain's kind of confusion in response to it, which we'll go into a second a little bit. This is the short of how IVF takes over your cycle regulation. I'm not going to go deep into that because Marija just covered it, but essentially we try to replicate as closely to a regular menstrual cycle with a couple of key differences being that we do try to do the trigger shot to trigger ovulation, and we do try to make sure that we ovulate more than one egg as well in the retrieval process as well. And so in the process of essentially trying to retrieve lots of eggs in this process to maximize your chances of conceiving a healthy baby, estrogen levels will usually be through the physiological roof. And Marija referred to that as well. But so we know that now that the brain is no longer controlling FSH, LH, progesterone, and estrogen levels, we need to mimic all of them. The problem is that once you have this exogenous, so essentially meaning infused, injected FSH, will override the natural selection process, which is supposed to essentially mean that only one follicle ovulates. And now we'll have multiple of those follicles ovulating, and each of them will be producing their own estrogen. So now we'll have 10 to 20 plus kind of follicles developing, and as a result, that much more of the estrogen hormone in your body as well. So that will essentially mean that your entire body is peaking. So now, just to give you a little bit of a brain perspective, the brain normally is used to producing one egg and getting those levels of hormones. Now it's knowing that it has no idea what's going on because it was cut off from the process, and it's suddenly flooded with 20 times the size. Like just the shock of it is actually going to be driving a lot of the symptoms. But I think it's important to visualize how weird that process is for our body, and the fact that we don't talk about the fact that our brain is blindsided. If the brain was involved and if we stimulated the brain to stimulate this release, then it would be different. But now this comes completely unexpectedly. And I know that a lot of people who experience these symptoms describe this feeling of like overwhelming sensations coming very, very suddenly. And so, yeah, as I mentioned, normal peaks should be in the 400 to 800 picograms per milliliter range, and then they peak 10 to 20 times that amount as well. And because estrogen levels are through the physiological roof, we know that that's impacting kind of all of the rest of the process as well. So this is just me detailing out kind of which hormone is done when, but we don't need to go into details here. And so, because the brain knows it's not in control, and the way that it knows it's not in control is because, as I mentioned very early on, we have these estrogen receptors, estrogen and progesterone receptors. So, if you look at this graph here, you can see estrogen receptors noted in red and progesterone receptors in black. And one thing that you will notice right away is that the vast majority of those receptors are actually concentrated in two main areas. So, the main area that it's in is roughly called the limbic system. So, that's all of the area here deep in the brain. And then we have some estrogen and progesterone receptors in the prefrontal cortex. So this kind of, it says frontal cortex next to it as well. Now, if you remember what I said, is that everything in our brain that's related to kind of basic core animal needs, that's going to be deep in the brain. And everything that's more superficial or kind of everything that's more human is going to be more superficial in the brain. So in those curly areas. So now if we think of estrogen and progesterone sensitivity, we know that most of the parts of our brain that are sensitive to estrogen and progesterone, that means that parts that will change in response to hormones, they're the parts that are very deep in us and in fact are responsible for emotion regulation. And the limbic system is our main emotional regulation center. So it's the part of us, of our brain that produces the feelings of love, the feelings of fear, the feelings of trust, memories, and things like that. All of that is in the limbic system, so that deeper part of the brain there. And then the frontal cortex is responsible for helping us manage those emotions, so not just follow our instincts. So, for example, an animal that is scared will just run away because they only have those deep brain parts. But a human experiences fear in that limbic system, and the prefrontal cortex will help us manage those emotions. So we'll say, okay, you might be scared, but this is just an injection. It's not going to kill you. You can do this. So, for example, Marija was describing that she was injecting herself and not letting her partner do it. That requires a lot of emotional regulation because, of course, you're scared of a needle. Of course, it's a big step, but your frontal cortex as a human allows you to overcome your fears. And animals, they just run. The animals really struggle overcoming our fears, but we as humans do it every day without even thinking about it. Like even getting on a tube full of people or speaking in public in terms of anxiety, we do that all the time. And so the brain, now it's used to kind of this balanced approach of having estrogen and progesterone in those two parts that it navigates between. But now it's no longer in control. And that creates a lot of confusion for this brain that knows that whenever hormones change, emotions will be involved. So as I mentioned, it's an unfamiliar environment for the brain, but the main parts that are impacted are exactly in this deep area. And so specific areas, so all of the limbic system is involved in emotional regulation to some extent, but the key parts that have the best evidence for being hypersensitive to estrogen are the hippocampus, which is responsible for memory, the amygdala, which is responsible for these fear responses. So actually what Marija described of not trusting her partner is involving her fear response. So she's afraid she can't trust him in that exercise, but also a lot of people will have different manifestations of it, like fear that it's not going to work out, fear that, you wouldn't be able to take care of a baby even if you had one. Like all of these different things get exacerbated because your amygdala gets involved. The prefrontal cortex in terms of control, the hypothalamus manages the communication with the prefrontal cortex, and the cerebellum manages kind of the integration of all of these processes as well. And so this is all to say that, like, even though IVF works by taking over the hormonal control of your cycle, because it disrupts the brain from not being in control, it will reach the central nervous system, mainly your brain, and will particularly impact these processes associated with your emotions, so emotion perception. So everything that isn't necessarily a real emotion you feel will now be exacerbated, as well as your emotional control, which is in the frontal cortex as well. And so if we dive into that a little bit deeper, I already referred to the fact that everything that's deep in the brain is the limbic system responsible for emotion, and the prefrontal cortex is very human in terms of controlling that limbic system. And what's very important is for us to function in the world, we need to always have these two parts of our brain balanced. So whenever our emotions are upregulated, so you're feeling lots of emotions that you normally wouldn't be, and hormones would contribute to that, your prefrontal cortex is supposed to control that. But whenever the signal is way too strong, you will lose emotional regulation as well. So I think there was a question in the comments that I saw earlier today, which was essentially saying, okay, like everybody told me that I could be sad or have those feelings, but I feel angry, or I feel that I can't trust my partner, or I feel all of these like a little child, like I just can't control. that sounds exactly like the prefrontal cortex being confused, because you feel all of those emotions all the time anyway. Like, we all have an inner child in us, but normally our prefrontal cortex helps us balance it, helps us keep it in control. And now, with these insane levels of hormones, you've essentially exacerbated everything you felt in your lizard or animal brain, and your prefrontal cortex isn't strong enough to maintain it because it's not used to that level of dysregulation. And so now you lose control, and you can lose it in any area of emotional regulation as well as cognitive kind of perception. So, for example, we know some people report brain fog, fatigue, migraines, and all of those. And those could be also linked to it, depending on what exactly gets upregulated in your brain in response to that estrogen surge. And so exactly all of the symptoms that patients feel, I think Marija covered it perfectly. But we do know that those are some of the most common symptoms. So in terms of mood, irritability, anxiety, and emotional lability are super common. We know the vast majority of IVF patients will see some sleep impact as well. And we do know that a lot of people complain about cognition as well. So brain fog being the most common. And the way that we believe it's primarily happening is because we have so much estrogen in our bodies, and then it targets all of our neurotransmitter systems, but disproportionately targets that kind of limbic system and prefrontal cortex dysregulation whenever it goes awry through the stimulation process as well. But where we are lacking a lot of kind of evidence is behind the patient experience. So if you look at most IVF trials, and Marija again referred to it as well, is yes, they look at reproductive outcomes, which is the reason why you're doing IVF. We want to know if were able to conceive and then successfully carry a baby to term, but they don't really study the effects on the central nervous system. And we know that there is so much estrogen sensitivity in the CNS. And for us at Samfire, we work a lot with PMDD, for example, which is a form of severe premenstrual syndrome. And we know that women who have PMDD, that's specifically a disorder of the brain being hypersensitive to hormones. So women with PMDD would expect these effects to be even larger. And even then, we don't know why someone might get it or not. So even if you don't know whether you have a condition or you don't have a condition, you might not know how you will respond to your brain being so flooded with estrogen as well. And we know that it's safe to do repeated cycles of IVF, but we have understudied any neuroendocrine effects. There's truly no evidence at scale as to what that does. Again, there's no reason to believe that would necessarily be detrimental by cutting off the brain, but the brain does rely a lot on feedback mechanisms as well. So sometimes it is important to understand that, you kind of take the control out of the brain, and that could have consequences, but they just haven't been studied deeply as well. And as we alluded to, psychological support during IVF is really important because of all of those symptoms. But I guess my role here is to emphasize that it's not only for pastoral purposes, so that's the right thing to do and make you feel better during this process. It's actually physiological as well, because there's this other axis in the brain called the HPA axis, so the hypothalamus pituitary adrenal axis. And you will notice that the first two parts are the same. Essentially, the hypothalamus and pituitary control so much of our hormonal system. But the adrenal glands participate in producing what's called cortisol. So you will have heard of cortisol as kind of the stress hormone. And we actually know that the stress hormone interacts with the HPG or HPO axis and will actually impact the way that those hormones get released. So, for example, we know that everyone undergoing IVF will likely have some level of anxiety, whether that be around outcomes, around the actual process, or just, as Marija said, oftentimes, we're not raised as little girls to expect this way to be of, having our child and bringing them to life. So it's just unusual. But we do know that higher anxiety scores do tend to correlate with lower oocytes, so lower egg yield, and can have impaired outcomes. And we know that the uterus itself is actually sensitive to cortisol. So there are cortisol receptor hormones. That's what CRH stands for in the uterus itself. And that could lead to essentially your stress levels indicating whether the endometrium should be more or less receptive to implantation. And that's why psychological interventions in IVF are incredibly important, because we know that if your body is kind of giving itself a signal that the environment is way too stressful to conceive, that could be a contributor to IVF success and could be a very important thing to take into account. So I sometimes find that this is may not be a very helpful data point because obviously you're stressed, especially if this is not going as planned or things like that. And oftentimes we might have relatively little control over the stressors in our life. But to the extent that you can control your stress while undergoing these processes, we know that they make a massive difference. And we do know that, for example, if you do have chronic conditions related to your mental health, such as anxiety or depression or anything else, managing them could also be really important to IVF success, because we do know that those axes talk to each other because they overlap at that brain level. So even though you could think that cortisol and ovaries and estrogen seem so different, they're both controlled by the hypothalamus. And so they both come together in the brain, and the brain won't differentiate one from the other either. In terms of egg freezing specific considerations, so obviously we focus here on the IVF process, but as Marija pointed out, egg freezing is really similar to IVF. The only things that are more specific to this process is that there is that more uncertainty element to it, in the sense that most women who are freezing eggs may not necessarily know when they're planning to use them as well. So there's a little bit of like life uncertainty. And a lot of women just might see that this emotional processing of having a child necessarily hasn't processed. And so there could be more anxiety around the whole process as well. And so that could lead to an interaction with this HPA axis, specifically referring to cortisol, and have an influence there. So yes, as biologically and in terms of what the brain experiences, IVF and egg freezing are very similar, but because they differ in purposes, they could be interacting in different ways with the stress system in our brain as well. And finally, we know that progesterone supplementation in the luteal phase equivalent of the cycle is incredibly important because it allows us to maintain the pregnancy after implantation. And I'm noticing the time, so we're about to just wrap this up. But essentially, progesterone supplementation is a very important part of the IVF journey to ensure success. But it's also important to note that a lot of women are sensitive to progesterone, and specifically to one of its metabolites, allopregnanolone. That's the molecule responsible for PMDD, for example, or severe PMS symptoms as well. So we do see it all the time. And we know that for women for whom these levels are so off the roof, even if you didn't experience PMS or PMDD-like symptoms before, you are likely to start noticing them on progesterone supplementation, which is, again, critical for you to maintain a pregnancy when successful, but again, will have an implication on your brain because your brain does have progesterone receptors, and we saw how widely distributed they are in those mood regions in particular as well. And similarly, just to say, that time when you supplement with progesterone is going to overlap with the 2-week wait. And the reason that's important is because obviously the 2-week wait is already anxiety inducing because you're waiting. But on top of that, you have all of these hormones that are leading to you having emotional dysregulation. So specifically progesterone that amplifies the limbic and prefrontal cortex activity. And that's when we see a lot of the symptoms of the 2-week wait actually overlapping a lot with PMDD symptoms, which are in the last 2 weeks leading up to your period. And they just are a result of dysregulated allopregnanolone linked to progesterone. And we don't really know why that's the case, because sometimes it's too much allo, sometimes it's too little allo leading to those symptoms. But we do know it's important to manage it because obviously it's such a critical time, and we don't want to increase the stress more than needed because we want to make sure to manage stress to maximize outcomes as well. And so I'll just wrap up by mentioning our products, Nettle and Lutea. So at Samphire, we built Nettle, which is a CE-marked Class 2 medical device. It essentially gently stimulates your brain in that prefrontal cortex that we spoke about and allows you to regain control over your emotions. And we do know that for most people, it improves mood, focus as well, and can reduce menstrual pain as well. And so in this context, we know that we have quite a few users who are undergoing IVF or egg freezing, using it to manage their emotional response to it, because we allow to kind of strengthen the prefrontal cortex and therefore control that limbic system as a result. And we personalize it fully for you. It doesn't matter if your cycles are regular or not. If you have any conditions, we'll take that into account and personalize it fully for your needs, for however many cycles you need to go through as well. And so there's just 5 key takeaways that I wanted to leave you with. So IVF and egg freezing essentially work by hijacking the HPJ axis, primarily by cutting the brain off. We know we have insane levels of estrogen that go to the brain and hit our estrogen receptors. So whatever symptoms you're feeling, they're very real. Your brain is literally flooded with 20 times the amount that it's expecting and unexpectedly. Stress is really important because it interacts at the brain level with your HPG axis as well. And progesterone supplementation supplementation that happens during the 2-week wait is also the same mechanism that we seem to notice in PMDD and in some perimenopausal women as well, because they all interact with essentially that progesterone conversion to allopregnanolone. And finally, you are in control. You are the one choosing to go through this process. And so we just hope to provide you some tools and awareness about your body so that you could prepare best. And that's it from me. And if you did want to try our products, we do have a special discount code for you guys. And if it doesn't work for you, you can return it within 3 months as well. But we do want to make sure that every woman is as supported during this journey as she can be, because even people who've worked for 15 years in the field, like Marija, still find those journeys, challenging. And I'm sure that's relatable to many of you. So thanks so much.
Thank you so much, Emily. I think every time we do webinars, I learn so much. Well, Emily, I'm going to be cheeky here, and I perhaps can't let you go just like that. I know it's time, but let's maybe stay for 10 minutes longer. If everyone who joined also would like to stay, please. But I think we have some questions that I really would like to ask.
I can stay to 5 minutes past, but very happy to answer any questions.
Fantastic. So we have one question. Lady had 2 rounds of IVF and she really struggled both times with the effect, and specifically around PMDD and HDHD. So now in terms of the hormonal exposure, do you have any advice that we can give to everyone who has those conditions?
Yeah, so we deal a lot with PMDD, as I mentioned, and about 70% of people living with PMDD will also have ADHD, so that profile is quite familiar. We know in general that managing those symptoms is the most important bit. And for the vast majority of women, unfortunately, the only ways of managing these conditions, especially PMDD, will be hormonal or kind of antidepressants. So if you're on those, then I would recommend kind of trying Nettle or other non-invasive options. We're literally certified to do this, to offer women a drug-free alternative for these options as well. So that's been a big focus of ours. But in terms of everything else, you should expect it to be very similar as a replication of your PMDD and ADHD hormones that you normally have, but it will be likely exacerbated by the fact that the estrogen levels are so high. In these conditions, we do know that women are already hypersensitive to those hormones as well. So we don't know if that means you've hit the ceiling and the higher levels of estrogen are just going to bring up your regular levels or worse. It sounds from the description that it was much worse. So in that case, the only thing you can do is manage it. Obviously, other hormones will not be an option like the pill when you're trying to conceive. You could try antidepressants, but a lot of women choose not to use them around pregnancy as well. But it is totally safe to use brain stimulation, and we've had a lot of success people doing that. I wish there were more options, truly.
Thank you so much. And Emily, can I ask you, because we did have quite a few questions in terms of how to prepare body before the treatment. Now, in terms of your product, can patients use it before IVF when this anxiety is just building up and anticipation that, this moment is coming, I'm going to have this treatment, will it work, will it not? So how in advance
100%.
Advice
100%. The earlier that you can start using it, in general, the earlier you can manage your symptoms, 1, the better your life will be because you'll feel better. But 2, it should definitely have an impact there as well. So essentially, again, our treatment is safe to use with all menstrual cycles as well, and pregnancy as well. I actually recently gave birth myself and used it all throughout my pregnancy to manage my mood, kind of throughout it as well. But essentially, you can start it with as early cycles, whether you're planning IVF or not, to manage those associated symptoms that you get in response to hormones. And leading up to IVF, if you're kind of considering that first beginning of the follicular phase equivalent, you could use it during that phase as well. But then we would want to personalize it for you based on your own symptoms. So the best way to do it is to essentially go on our app, and then we ask you a bunch of questions, and then we personalize it to your experience based on when your cycles are, what your symptoms are. But the earlier is roughly the better, because we get to build up your brain's own resilience. Because again, our device doesn't take over your brain function. We just strengthen your own prefrontal cortex to be able to manage your emotions. And so as a result, the more heads up we get to kind of make sure that it's stronger, the better it is. And if you do manage those symptoms, your stress levels are likely going to decrease.
Thank you so much. And I'm going to top you up with another question. I'm going to try to be quick. So, if you can explain, so how long does it take the brain to actually recover and take back the control from IVF cycle? And do we have to take this break before we start another IVF cycle? And are there any long-term effects on the brain in terms of what we have discussed?
Yeah, great questions. To be honest, research is very, very limited. So for most women, we don't know how long it takes. We do know that some struggle to recover. It's kind of similar to if you've ever been on hormonal contraception of any kind and then you stop using it. Some women get their periods immediately after, and some it takes forever to get them back as well. That just responsible to essentially how well the HPG or the HPO axis kind of control is there. Based on everything that I know, the hypothesis would be that if you keep doing nonstop cycles, the brain kind of loses practice of controlling your menstrual cycle and then it keeps getting flooded. So it's likely that if you keep doing them nonstop for an extended period of time, there would be a long-term impact. But based on kind of most cases of IVF application, I think usually like people might do 2 in a row, but then take a little bit of a break to kind of allow the brain to restore that control. That's usually fine. But we don't know what that limit is. Like, could you do 3, 4 in a row? It's not exactly clear. But a good proxy would be if you've ever stopped using hormonal contraception, kind of thinking of how quickly your cycles resumed. And I would suspect that for people for whom it took a lot longer to resume, it means the brain was kind of out of practice, and you're likely going to see a longer recovery period there as well. But so individual. And again, everything that Plan Your Baby does is literally based on the fact that every woman's body response is different. So it needs to be tailored.
Yes, absolutely, totally agree. And last question, that will be hopefully a quick one. Can the devices be used during the exactly IVF cycle, which you said yes, but patients, do they need to inform their IVF specialist that they're using this device or not?
Yeah, so they don't need to, they can. It's a fully approved kind of treatment that can be prescribed. It's not yet reimbursed, which means you will need to pay out of pocket as well, but you can let them know. A lot of them might not have heard of it before. We do have a clinician data pack you can give to them to just give context on, like, understanding whatever is happening, and we're happy to speak to them as well. But yeah, I mean, it's always good to let them know whatever you're doing around it. But again, this is mostly on your mood regulation and at a pretty superficial level. So there's no way for it to interact with whatever treatment is going on. And this is mostly there to support you. And it only supports the actual outcomes to the extent that it helps you manage your symptoms and help you manage that stress levels as well, which could obviously be interfering with it too.
Thank you so much. Well,
I do need to jump off, but I do think I've left my email. So it's m@samfireneuro or support@samfireneuro.com. So if you email the support channel, we're happy to answer any questions you have. We're happy to engage with your clinicians, provide any further information as well. And yeah, I'm happy to answer any scientific questions as well, and wishing you all a lot of success. Thanks so much for joining.
Yes, thank you so much everyone for joining, and I really hope the webinar was useful for you, and we will share the recording. And yes, and thank you so much for all of the questions, and feel free to email us and contact Plan Your Baby, and we will answer your questions if you feel like we have not done that. So yes, I will wish you a good night to everyone, and thank you so much. I really enjoyed it, and I hope so do you. Good night.